My name's Paul Mackney. I'm co-chair of the Greece Solidarity Campaign, which has the support of all the unions in Britain, but lots of other people as well, Phil Hellenes and so on. And we're here because what's happened to the health service in Greece, you can see similar trends here. Not yet as dramatic, but if...
What has happened to the health system in Greece?
Oh, well, with the collapse of the Greek banks and the Greek economy, you had 2 to 3 million people who didn't have insurance. Therefore, they weren't allowed to access the health services. But what has happened, which is good news, is there's a whole network of, a whole network of social solidarity centres where people have stepped in and re-established the service. Then the newly elected government from a couple of years ago has reinstated people's rights, whether they've got insurance or not. How does it happen? If you're out of work for a year, you lose your insurance rights. That's how it happens.
It's the most expensive thing any country could do.
I am, yeah.
Where at?
In London.
What do you think about what's happening with healthcare?
It's absolutely disgraceful, to be honest with you. I think telling a patient that their operation's cancelled when they already feel like they're on borrowed time is one of the most heartbreaking things that anyone can do, let alone someone that's not even qualified yet, and that's the NHS that we're living in at the moment.
Yeah, I think everyone's just very angry because no one's getting the care or the treatment they deserve, and yeah, they're ruining the NHS, what it was like years and years ago, and no one can have access to any resources anymore. So yeah, it's like running off no fuel at the moment, and it's only the staff and the morale of the staff that's keeping it going. So.
And the future?
It's hard to say. I will always be a nurse. It's what I love. It gives back to something that I've used so much in my life, but right now it's incredibly hard to do it the way that we want to, which is for the patients.
And the May government?
Get them out, please.
Jeremy Corby?
Yeah, get him in.
And Donald Trump.
Oh God, Jesus.
No.
Big crowd.
My name's Gareth. I've come from Manchester, which is about 200 miles away. I believe sincerely in the NHS. The Tories have put in charge a fella called Hunt. Now this bloke has written a book on how to privatise the NHS. There's no hidden agenda there, is there? All that happens is they go in, they privatise, and like Carillion, it goes tits up and the people have got to bail them out. That happened time and time again. It's happened with Southern Cross, which was a service provider for older people. That fell apart. It all comes back onto the taxpayer and the ratepayer. And they blame the local councils for not doing enough, and they don't supply them with any funds to do it. They're just a horrible bunch of bastards that are just looking after themselves. If you're not rich, tough shit. That's a Tory attitude.
And you think that these protests are going to stop the May government?
It shows them that they're not doing it with the consent of the people. It will be demonstrated. This will go on social media and the like, and this will go internationally. That's why I want Trump to come to this country.
You're waiting for Trump?
I'm waiting for Trump.
You're waiting for Trump?
Yeah, I want to give him the welcome he deserves. Not the one he wants, but the welcome he deserves.
Well, he thinks he's loved by people.
He must be. Yeah, well, yeah. Well, he's always been living in cloud cuckoo land, hasn't he? He's not in the same world as the rest of us. If he thinks he's loved, then come to Britain and we will show him how much we love him.
You'll give him some love?
We'll give it. Well, I wouldn't call it love. I can think of a lot of adjectives, but love wouldn't be part of it, I can assure you.
Now Manchester is the beginning of the Industrial Revolution.
To an extent, yes.
And now you have automation, information technology, artificial intelligence, which may lead to the loss of millions, hundreds of millions of jobs.
That's already happening. That bitch Thatcher, she did away with all the training programs. We don't have the skill base anymore. Previously, a company would pay a certain amount as a levy, and that would go for the training apprentices. She did away with that. So the Company A isn't going to train apprentices for Company B to poach them a few years later after they've spent the money. So nobody's put money into apprentices. Consequently, we don't have the skills. That's one of the reasons we need the migrants over here, because they're the people with the skills. All our skill base is gone completely. You try finding a plumber under 50 and you'll have a hell of a hard job. You'll get people who can join pipes, but hell, I can do that.
But it's also our engineers. Yeah. You know, engineers, you talk about information technology, and, you know, we are, you know, right now thinking about jobs, the losses of jobs. Yeah. Artificial intelligence taking over. What are we going to do? Not just, we've got massive issues with the young people. Yeah. Disfranchised in this country, the increase of drugs. Yeah. Why? Because they're different.
They can't see a future.
They can't see a future.
Is that why people are supporting Jeremy Corbyn?
For multiple
so.
reasons.
Yeah,
Multiple reasons.
Tony Blair took over where that bitch Thatcher left. Yes. He was Tory light. He was a true heir and successor. And as a Labour man through and through from years ago, I left the party because of him. I'm from the valleys in South Wales, right? That's Labour, 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 not New Labour. Not the fella shifted the party so far to the right, it was indistinguishable from the Tories. I detest that bastard with a passion, I really do. And it goes for a hell of a lot.
So where's capitalism going?
To hell in a handcart, and taking us with it. Because look at it, was it 42 people own as much wealth as the 3.7 billion people? You tell me that's right? The shift of money to the top is going from the people at the bottom. Sooner or later, the people at the bottom are going to get pretty pissed off with that, and something's going to happen.
You think there's going to be a revolution?
I would hope so.
Well, I think there is a movement.
God, yeah.
Social media is raising the issues, it's identifying the issues, and giving, not edited, you know, what the general right-wing press wants to show us. You know, you're giving the full picture, and it's unedited. And this is what the young people like. Yeah,
because the media is so controlled by the right wing, that Murdoch and Beaverbrook and all that, the Mail and the Express are comics. The only thing I believe on that is the date. You know, I wouldn't believe anything else in the paper at all. It's just so biased and twisted, it's untrue. But that's the most popular newspaper. They're leading older people by their noses.
Why haven't the unions...
They've emasculated the unions.
The unions could have their own TV channel. The unions could... This could be live worldwide.
It will be live worldwide, but it'll be done via social media and all sorts of things like that. We're not needing that. The British media will say a few hundred people turned out. Social media will tell the truth. As folks who've come... I've come from 200 miles. Folks who've come a damn sight further than that down here today.
It's like it's just discussing, we're saying about the actual numbers that will be here today. We'll wait later on today to hear from the police, and they will give us a number, but we will simply, realistically, double it.
Yeah.
So you don't believe the media here?
Oh, shit, you're kidding. Absolutely not. It's so biased, it's untrue. Absolutely biased. But you've got to have a lot of money to set it up, and these people got deep pockets. All they're interested in is keeping themselves and their rich cronies in power, you know.
How long do you think May's going to stay in?
Look, if the choice is her or that absolute idiot Rees-Mogg, because he's in the same gaga land as Trump, I tell you. He's just not of this world, that fella.
Yeah, my name's Andy Spink. I'm a nurse in England. Worked for the National Health Service for 25 years.
And what's happening with this rally today? Why are you here, and what do you want to happen as far as a change in the healthcare system here in Britain?
Well, I'm here to give the strongest possible message to our government that we're totally opposed to the way they're handling our National Health Service. They are privatising it. They are lying to us. They're lying through their teeth to the public. They've radically changed laws that protect our health service, and they're privatising services and outsourcing services. We do not want a privatised health service in this country. We do not want to go there. This is our health service. It's for us. It's for all the people, and we need to stop this government from doing this massive damage that they are doing.
And part of the outsourcing was a Carillion company that went bankrupt. What was that all about?
Well, that's one company that's taken hundreds of contracts for public services. They've got their fingers in all sorts of pies, and they're building hospitals, they're providing food in prisons, they're doing all sorts of things. I don't know the ins and outs of it. They've borrowed heavily and they've become bankrupt. They're not able to pay their suppliers, they're not able to pay people that they've subcontracted to. It's a clear example of how private companies run public services badly, and it's a myth that they run them more effectively and cheaply. They don't.
And are you in a union?
I am in a union, yes.
Is the union supporting the rally today?
They are. I'm a member of Unison. I've always been a member of Unison, and they are. They will be here. They will have a delegation here. Yeah, I've come alone, all the way from Yorkshire in the north of England.
And there seems to be a lot of wealth in London, a lot of billionaires. You think that's what's happening in capitalism today? The rich are getting richer, the poor are getting poorer?
Absolutely. Capitalism's successful at one thing: making rich people richer, making poor people poorer. A country should not be judged on its success by the number of billionaires it has. It should be judged on its success by how equally that wealth is distributed among its people. It's the same for the health service. How a country treats its sickest people is a judgment on that country.
And as a nurse, does it frustrate you that people need help and they can't get it because of the budget cutbacks?
In the health service, we are facing huge demand for service, and we haven't met that demand. We've shrunk our capacity, we've offloaded staff, and we've really managed it appallingly. And that's ideologically driven. It's about trying to make an health service cheaper when what we should be doing is making it as high quality as possible. For nurses on the front line, we're working 10 times harder, with much more patients, much more stress. Nurses are going home from shifts exhausted and demoralised on a daily basis. Times are hard.
So it's unhealthy not just for the patients but the nurses.
Absolutely. I love the patient. That's why I care about people. I care about the patients. But the nurses are suffering as well under this stress. They are, and I want to get that message across.
And what about the political situation? Jeremy Corbyn may be the next Prime Minister. Do you support him, or what do you think a change would mean if Jeremy Corbyn was elected Prime Minister?
I absolutely do support Jeremy Corbyn. He's a breath of fresh air to politics, a man with honesty, integrity, a track record of making the right decisions, being brave enough to stand against his own government when he knows they're in the wrong. When millions of people march on the streets against an Iraq war, for example, and a government ignores the people. So, Jeremy Corbyn, absolutely, we need honest integrity.
My mum and dad work for the NHS. My mum's a doctor, my dad's a GP, and both retired. Haven't had a good experience recently with it.
And why is there a crisis in the NHS?
Underfunding. Cuts made by the government, which we're marching against today.
And are people dying because of lack of funding?
You bet.
Why don't you introduce yourself?
I don't want to.
Okay.
Go on, man.
Why don't you talk about what's happening? Can you talk about it now? Okay. Okay. So.
Is this going anywhere? Or?
I'm from the United States.
All right. Oh, really?
We're a labor news station in the United States.
Okay.
Okay. So, what kind of work do you do?
I'm currently a student.
And are students affected by the economic situation here as well?
Yeah, definitely. Yeah, I recently had a problem with mental health, and I know a lot of people who have had similar problems and haven't been able to have spaces in hospital, and there's no beds for them. They have to travel really far. just be able to get a bed. So yeah, that's why I'm here today.
And what do you think of President Trump? Asshole. Be honest.
Asshole. I don't like him, no. I don't.
How do you think a guy like that could be elected President of the United States?
It happens. It's happened throughout history. All powerful people can get into, yeah, the Nazis, yeah. I don't know.
I mean, the money that is not being spent on healthcare, where is it going in Britain? Because there seems to be a lot of wealth here in London, a lot of rich people, and
I think the wealth is going to the wealthiest people in the country, and it's being diverted from where it should be.
Do you think that the support for Jeremy Corbyn is a backlash to what's happening economically in England?
Partly. I also think he's quite a good guy. We like him.
Jeremy, yeah.
You like Jeremy? Why do you like Jeremy?
He's for the youth, really.
Yeah. Much worse than in my generation. I got free education. I only got to be a doctor because of free education. You can't have that anymore. You don't get that class mobility anymore.
And what does it feel like when you want to do your best job treating people and yet the funds are not there for proper treatment of people?
It's really frustrating. Very frustrating. Yeah.
You're trained to be a doctor, yet because of the system you're not able to.
Absolutely. Yeah.
You think people are fed up in Britain?
Yeah. Yeah. I think it's a lot of people who just don't see it. I think there's a whole class of people that it just doesn't, they just walk by the people that, if you look around, there's people everywhere sleeping in doorways. They just walk past it and they don't see it.
So there's a big problem of homelessness in London?
Absolutely, oh gosh, not just in London. I think Manchester maybe is the worst I've seen. Manchester's the worst.
Yeah, we're going there next week. People's Museum we're going to visit.
Yeah.
You know, the wealth in Britain, you're saying it's going to the top people, the billionaires, and what's their reaction to the fact that people are homeless, people can't get health care?
They just buy their own private health care and put their taxes abroad, don't they? And there's no stopping it. It's very, very corrupt at the minute.
You think Corbyn's going to be the next Prime Minister?
I hope so.
We hope so. But I don't really have any faith in the system. So I think it's all kind of cooked. I don't know.
My name's Jean. I believe in the NHS and I want it there for my grandchildren and my great-grandchildren.
And how is the NHS being affected by the budget cuts?
There's services being cut left, right and centre. A&Es are closing down all over the country. People where I live are now...
Where do you live?
I live in Lincolnshire, and people in Lincolnshire now, many people are an hour's drive from the nearest hospital to the nearest emergency centre, and that's not right.
So you think people are dying because of the cutbacks?
I think they are, and if they're not already, they will be. An hour's drive from a hospital, if you're having a heart attack or a stroke, it's not rocket science, is it, that people are going to die?
What does it say about the fact that this is a rich country, a lot of wealth, and people are dying and are in the streets homeless?
Well, it says a lot. If a country like Cuba can provide a better health service for their citizens and have lower infant mortality rates and a higher age life expectancy, then and that's a poor country, and we're a rich country and we should be doing better.
Is this capitalism?
Yes, I think it is, and I think it's capitalism gone rampant. And I'm not saying I'm against capitalism, but it needs to be kept in check. There needs to be, and because a healthy workforce is a productive workforce, and if you can't keep your workforce productive, healthy, then you're producing less.
What do you think of Jeremy Corbyn?
I like Jeremy Corbyn. Yes. I've got my Jeremy Corbyn scarf.
Why are you here today?
Because we want to rally to save the NHS.
How old are you?
10.
Can you talk about why you're here today?
Yeah, to try and save the NHS from privatisation. We want it kept.
And what does privatisation mean for your health system here in Britain?
It means that you're selling it off to private companies to make a profit rather than keep ordinary people in jobs. I don't believe in profit for for the health service.
And it seems there are a lot of billionaires here, rich people in London.
Absolutely, and empty flats when there's homeless people. That's wrong as well, isn't it?
Is there many homeless here in London?
loads. I couldn't tell you how many, but an awful lot. Yes, we've just passed 10, just walking from the station.
What does it feel like to see the homeless here in London?
Feels pretty upsetting, really. You can give what you can give, but they need permanent homes.
And you used to have a lot of public housing in Britain. What happened to it?
Exactly. The Tories got rid of it. They sold it off years ago under Thatcher. And then no government has had the sense. That's why we believe in Jeremy Corby, because he wants to build social housing. And that is the easiest, best way to house people.
You think housing should be a right?
Absolutely, definitely. Definitely. Yeah, are you from America then?
Yes, San Francisco. Yeah. And what do you think of Donald Trump?
I think he's appalling, sorry. I don't know if you're a Trump supporter, but I think he's mad. I think he's a racist thug who's got there God knows how. I do not know. I don't know who would vote for an nincompoop like that. But similar here, isn't it? The racist.
There's a rise of racism, blaming immigrants, blaming...
Definitely. And without immigrants, our health service wouldn't run. So why would you blame them for that? They come over here and help you. I'm just not. I don't see colour. I just don't see it. And I find people who do ignorant.
And what kind of work did you do?
Me, I was a PA, secretary, and then I ran my own shop for quite some time and a post office, so, yeah.
And they're trying to privatize post offices?
Yeah, exactly. Why do they think that's good? I don't understand it. I never have.
Somebody's making money off it.
Yeah, exactly. I believe in nationalising the railways. Thatcher sold off electric, water, everything we owned, and people don't realise, who talk about immigration and things and racism, that it's foreigners who own our water, it's foreigners who own our electric. They don't seem to mind that, do they? It's just people walking down the street that they don't like.
You think Jeremy Corbyn is going to be the next Prime Minister?
I do. I sincerely hope so. So do we, don't we? And you're the next generation.
Yeah.
That's why they're here. They're the next generation who need the NHS.
My name's William Westwell.
There's a rally here for the NHS. Why are you here?
The NHS is being privatised, run down to nothing. People are dying in ambulances. It's an absolute scandal. It's not really a question of putting pressure on the government, we think, but the government has to go. It has to be brought down. And there should be a workers' government and socialism that will properly fund the National Health Service and invest in it instead of trying to bring in American healthcare companies, which is exactly what they have decided they're going to do. So
they said America plans will make it better, the American system. You don't believe them?
No, well, it won't be true. You have to pay for your healthcare. We already pay through taxation, and in 1948 the National Health Service was set up to be free at the point of need and paid for through taxation, and that's how we want it to remain. We don't want it breaking up into tiny little bits, which has already happened. 44 separate STPs, sustainability and transformation plans, and these are all plans about breaking up the health service and pushing through huge cuts in expenditure so that they can build new, what do they call them, accountable care organisations.
These sound like American terms.
Well, precisely. They were brought in by Simon Stevens, the head of the NHS in England, and he planned it all about 5 years ago now at Davos, where all the rich people live, and they're pushing it through. And in the meanwhile, the May government is being kept in place. That's the government that's making all these cuts. It's being kept in place by the Labour Party and the trade union leaders.
How does the Labour Party keep this in place?
By refusing to call a vote of confidence in the May government, and they've had opportunity after opportunity to do so. Her cabinet ministers are being kicked out or abandoning her. They're split from stem to stern.
Why aren't they calling for a vote of confidence?
Because they're terrified of taking the power.
Why is that?
Because they know that they'll have to deal with the European exit and that it will be a dog's breakfast, which it already is. And they don't really know what to do anyway. So it's part of a much wider degeneration of politics throughout Europe, really. There isn't a single stable government in Europe, is there?
Is that the crisis of capitalism?
Pardon me?
Is that a crisis of capitalism?
Very much so, yeah. You can't have debts running to 3.5 times the actual income of the world and expect to pay them back. It means that there's going to be an enormous banking crash, and in the meanwhile that's being paid for by cuts in the health service, pensions, public services generally, housing and so on. And we don't want to pay for it anymore, thank you very much. We'd rather nationalise the banks.
And how are you going to bring this government down?
With a general strike. A prolonged general strike, a political general strike, will bring this government down very, very quickly because it's so weak. You know, it doesn't have any, what's the word I'm looking for? There's no stability left there at all. They don't have leadership, they don't know where they're going, and the power is there to be taken in Britain, really.
You think that's the same in the United States?
It's getting there. But in the United States, the working class needs to build a Labour Party and get rid of the Democrats and the Republicans. I mean, your man Trump is basically giving out huge handouts, isn't he, to big business and so on. And it will be the workers who pay. And there is a resistance to it from all sections of society, I think.
So you don't have a good attitude towards Trump? Isn't he escalating the decline of U.S. imperialism?
Well, you could argue that. In the meanwhile, he's preparing World War III, and it's a question of which goes first, isn't it, really? And in that, the working class does have to play an independent role, so, you know, we have to see. But
what do you think of Jeremy Corby?
He's a mouse. He hasn't said anything about the Tories that's worth hearing. He describes himself as being the leader of a Labour Party which is in waiting for government, a government in waiting. Well, we're not waiting 5 years, it'll all be over by then. And that's all he has to say.
So you don't think you can reform capitalism?
No.
He's a social democrat?
He is a social democrat, and you cannot reform capitalism. The crisis is too deep. And you can't bring in socialism by small degrees of nationalisation, a little bit of nationalisation of the railways here, a little bit of nationalisation of the health service there. It's, you know, we want the lot, frankly. And it is time to do it. The productive capacity of the world is enormous, and it's high time to fund all these services so that people can have decent lives.
My name's Linda, and I'm a nurse at the James Paget Hospital in Yarmouth.
And how has the privatisation of the NHS affected you and other nurses?
It's the trying to privatisation of it is having a massive effect because there's no money going into the people who've paid all their life to be a part of the NHS. So all the people who've worked all their life to get a good service are suffering now because they can't get beds, they can't get operations, they are waiting on trolleys in A&E because all the local hospitals have been closed down. So these poor people who are so-called bed blockers have nowhere to go, and the people who are needing them critical beds have got nowhere to go either. So we're stuck in a vicious circle which has been destroyed by the Tory government.
Are people dying as a result of these cuts?
Well, I don't know. I don't know that people are dying, but people are suffering and they're not getting the care that the nurses want to give.
And the situation of the nurses, I know in the United States a lot of nurses are stressed out, they're overworked. Is that the case here in Britain?
Oh my God, yeah. I've been on 12-hour shifts where you have barely time to go to the loo, like have a drink. The nurses are they're working under stress the whole time. They're trying to do their drug rounds, they're trying to do skin assessments, they're trying to discharge patients. They've got A&E ringing up, trying to get patients in. The phone rings off the hook. The patients are needing all sorts of care, and there's not enough nurses.
Sounds like a madhouse.
It is a madhouse, and you've got the relatives asking why things aren't done, and there just isn't the time in a 12-hour shift to get everything done. And you think you'd have loads of time on a 12-hour shift, but there just isn't. And you go home worried about all the stuff that you might not have done. when you should really have plenty of time to do it.
So, what's your name?
Sally.
Are you angry?
Very, very angry. This government is corrupt. It's lying.
Affecting healthcare.
Because Tories are saying there's no privatisation, but there is. Many, many services have already been privatised. When they are privatised, the money goes to profit for shareholders. It does not go back into the NHS. That is not democracy. They're making the services private with no public debate and no parliamentary debate. That is not democracy.
Girl is just there, that's her.
Oh, okay.
So what is this picture? This is your...
This is our daughter, yeah.
And what's the story about?
She was born early at 30 weeks, and basically they saved her life in the local hospital. She stopped breathing at 8 weeks old, and again they saved her life. And she's here to tell the tale. She's 2.
You want to save the NHS?
We definitely do, yes.
Your daughter?
Yes. Yes, yes, 5 times.
And May, the Prime Minister, what do you think of what she's doing?
Well, yeah. let's keep it where it is and not sell it on. It's just ridiculous.
What's her name?
This is Melody. Can you say hello?
Yeah, we're here because we are not having pleasantry in this country anymore. It's a little bit difficult for livelihood now, so things are not going well. And this is why we are all out to ask the government to look into this issue on social welfare, on workers' health, and also the NHS.
My name's Richard.
And why are you here today, Richard?
Well, I'm here to show support for the NHS and show that we're opposed to the Tories trying to cut it and privatise it.
What kind of work do you do?
I'm a computer programmer.
And how are people being affected by the privatization of the NHS?
There's waiting times of hours in emergency rooms and beds stacking up in hospital corridors. It's just chaos out there.
Sign migrants make our NHS. What does that mean?
The NHS requires immigrant labour because we haven't got enough people to do the jobs, and if it weren't for all these people coming from abroad, then the NHS wouldn't be able to function.
Hi, my name's Steph. I'm here. I'm part of the People's Assembly. I'm here to protest against the cuts to the NHS and the privatisation of the NHS.
And what does privatisation mean?
It means basically selling off parts of the NHS to private companies and starving the NHS of funding. So, you know, we see 20 ambulances lined up because they can't get into A&E. There aren't any beds. And just the complete kind of underfunding of the NHS. A recent report said they reckon an extra 200,000 people have died directly as a cause of cuts to both the NHS and to social care. And when this government's policies have been shown in evidence that they're actually killing people, enough is enough, and it's time we protest and make sure the NHS is properly funded, which means kicking the Tories out of office because they will not protect and save and fund the NHS.
And what do you think of Trump?
He's an arsehole. In a nutshell. Yeah.
Thank you. Are you a healthcare professional?
Okay, I'm a qualified doctor, and I want my voice to be heard because, you know, the requirement for entering and working in the UK is very high. Like the English test is very high and very sophisticated and has no relation to what I'm doing. So I need my voice to be heard in order to reduce the level or the score to a little bit to a small level.
Okay, thank you.
Rachel.
And why are you here today, Rachel?
To defend the NHS from privatisation.
What does it mean?
And cuts.
What does that mean, this privatisation?
It means that we'll no longer have an NHS that works for free for the people.
You think people are dying as a result of the cutbacks?
They certainly will be.
And your children?
Yes, I'm getting the honour. Yes, they are my children, yep.
You're worried about their future?
Absolutely. I've been to America. I've experienced the American healthcare system.
What did you learn about America?
I went to America and I ran out of my inhalers because your air quality is worse than ours. I went for 2 months and I ran out at 8 days before leaving, and I went to CVS, the pharmacy, and asked how much it'd be for my inhalers. £900 per calendar month. That would not be covered by insurance because it's a pre-existing condition. Anyone with a pre-existing condition should be here today, unless they're really rich, and rich doesn't last forever. Nor does good health.
Where's the money going?
Into the pockets of fat cats and Tories.
Richard Brunson. You think May's going to last long?
No. No.
What do you think of Trump?
Oh, gosh. Yes, what a buffoon. But while we're all watching the buffoon being a buffoon, the man in the background's a bit scary, isn't he? I think Pence is far more dangerous.
My name's Helen. I'm with this lovely lady here who's got a great banner. And I basically want the NHS saved. I'm a carer for my mother, and if it wasn't for the NHS, she wouldn't be alive today. And it's getting harder and harder to access services. You have to, the time to get an appointment is taking longer and longer. When you go to A&E, it's taking hours and hours to get seen. And this government, for some reason, assumes that we can get more out of less of a budget. I don't know what school they went to and learnt their maths, but from where I'm coming from, it just doesn't add up. And I met Mr. Hunt once, and when I last met him, I congratulated him on keeping our local hospital, Lewisham A&E, open. He thought he could shut it down, but the courts overturned him. As soon as I told him, congratulations on us winning, he legged it and went bright red. Mr. Hunt, if you can view this, I'm back again to haunt you. Goodbye. A job to be a carer for my mum because the system's not set up. And I remember working in the West End as an accountant, and I worked in lots of media industries, lots of glamorous companies, and I had money to spend. I could come and go as I wanted, get black taxis home. Now I'm living day by day, and I even have to make my own sandwiches because trying to make a pound stretch is beyond belief. But I'll do it for my mother because I love her, and thousands of us are doing it in the UK as well. Mrs. Theresa May, if you're watching, and Mr. Trump, go to hell, the lot of you.